Hi, this is Chris Chen from Taiwan, along with my colleague Grace Chiu and my mentor Jean Roberts. We would love to present an ortho implant combined case. This young lady has three major problems. Number one is protrusion. And number two, she also has a huge molar space to close. And number three, a failing incisor. How would you fix a case like this? There are three keys to solve this problem. Key number one is the key to solve severe protrusion. 18 months in treatment, we found we still have protrusion, no overjet, 3 mm upper premolar space left. What would be the solution for that? We use mini screw to solve this problem. The way we did it is we put a mini screw in buckle shape and hook out the power chain that produce a 10-ounce force to move the whole dentition backward. At the same time, we also hook up class 2 elastic that produce the force to move the upper dentition backward. In other words, with this mechanic, we'll be able to move upper and lower dentition backward. That's how we solve this protrusion. So with 4 months, we'll be able to solve this problem. Key number two is the key to close huge low first molar space. Very difficult indeed. And the way we did it is buccal lingual mechanic. Why? Why we need a buccal lingual mechanic? Because if you only hook out the power chain in the buccal side, you not only close the space, but you also create a moment. And that moment can widen the lower arch, which is the side effect. To solve that problem, we need the other counteract moment. And the way to do it is so easy. We bump the lingual button and hook out the lingual power chain. And that will even up the moment, and it will be easier to solve, to close that big molar space. Buccal lingual mechanic is the key. And problem number three, how to fix this failing incisor? I would have my colleague, Grace Chiu, to explain to you.
Key number three is how to fix this failing incisor. We use autogenous chin block to augment the area. And after 4 months, due to the quick angiogenesis and osteogenesis of the chin block, we will be able to build up a nicely ridge, and we can place the implant and continue to augment the area with connective tissue graft. And this is the final processes. 8 years follow-up. So we can see patients still maintain a good and acceptable functional and aesthetic result. And around the implant, there's minimal bone loss. And there's less than 0.5 infra occlusion in the central implant area. And there's 3 reasons for that. Because in the adult patient, there's a minimal facial growth. The second one, on the ortho treatment, we build up an ideal occlusion and provided a mutually protective occlusal skin. The third one, patient is a good compliance with the removable retainer at night.
To conclude this report, also implant, they are perfect companion. If you are interested about this presentation, you can find it in AJO-DO Clinical Companion, April edition 2022. With that, thank you for your attention. This is Christian from Taiwan.